We have such a short training program. You know, we're expected to be GPs having trained for 3 years. We have the shortest training program, and I would argue the most difficult specialty. I mean, we have the broadest kind of scope in the patients that we treat and the conditions that we see. So even in 3 years of clinical facing time, it's a really challenging training program. And even within those 3 years, you know, in parts of the country, you only get either 1 year or 18 months in general practice. So you might be in kind of hospital roles for the first year of training, and then you only get, you know, two years, 18 months, even 1 year in general practice. And that might be the first time you've ever been in general practice, you know, having been through medical school and foundation years. Our priority would be to get more clinical facing patient time in general practice, and there's nothing that's probably can be replacing one-to-one patient time in general practice, and that really is how you get the best training. And that's what the college's message has been for many years. You know, when it comes to our assessments, when it comes to our workplace-based assessments that we're doing, it's all about evidencing our communication skills and our management of patients. So we think that message stands strong, that's the best training that you can get.
Certainly more time in general practice is needed. I mean, in Scotland, they still only spend a year in general practice, which is just madness. And I know our colleagues in Scotland are really trying to use the upcoming election as a way to sort of lobby for that change. So, you know, in other regions of the UK, we do get 18 months, but still, as Molly said, a lot of people that will be their first time in general practice. So, yeah, there's definitely more time. And I think, you know, there is value in the secondary care posts we have, the experiences you can get from working in, you know, various settings of secondary care. But I think the importance is it's got to be addressing clear learning needs. So I think more time in general practice, yes, but also the time out of it needs to be addressing, you know, the individual registrar's sort of gaps in training, really. And yeah, training length, I think we're quite keen for a conversation about that. I know that's been had in the past, and I think the college has had a position that probably we need to look at whether training should be longer, but clearly there's a big funding issue there.